Problem is, it's very difficult to toggle that off, that air of authority. So what starts to develop is some isolation, because being a cop is not a normal job. What you guys see and hear and do in the course of a day, civilians don't see in a lifetime. If I see a DOA, they look better than me. They're dressed nice. They got nice skin color. They're laid out. They're comfortable. They got a bottle of Jack under their arms. You see a DOA, they don't look good. You know, whether it's a jumper or self-inflicted or a man under. Then what do you do with that? Do you go home and start to share everything you've done? Sometimes you can, but you really can't. So more isolation, more withdrawal. Then, you know, you go out to eat. Where are you sitting? Where's your back? Against the wall. And while this person that you're having dinner with is trying to have this important discussion with you, what are you looking at? You're scanning. You're in scan and pounce mode. Again, more being considered aloof or disconnected. You can get invited to a wedding or some event, and someone asks you, what do you do for a living? I'm a New York City police officer. Wow. What's it like to shoot somebody? I always wondered. And I saw on TV, they shot the guy 7 times midsection. Why didn't they just shoot the gun out of their hand? And your response is, okay, I'm not going to speak to you either. You know? So it's that distancing. So that's one of the pillars is that isolation and distancing that develops. Another one is moral injury, which we're starting to see a lot more of right now. And that's where you witness or you're involved in something that goes against your moral, ethical belief system. And you're left sitting with that. Should I have said something? Should I have done something? Oh, I did do something. Why'd I do that? So that confusion plays into it. Some of our cops by generation now that we've raised also have a very hard time sitting with discomfort. They look to get rid of discomfort very quickly. And how do we get rid of discomfort? We drink, we overshop, overspend, overeat, gamble. We engage in activities that they don't cause suicide, but some have a correlation with a really bad outcome. And the last one is something called approval being performance related. Again, we've raised a generation that's used to participation trophies. And a lot of our officers today cannot tolerate not getting approval, especially from a boss. And that sends them into a bit of a tizzy. But, you know, those are some of the pillars, but you have to think, you know, genetics. We've identified 4 specific genes that people who are suicidal have that non-suicidal people don't have. You know, there are developmental factors, environmental factors. A lot goes into it. It's never, look at depression. Depression causes suicide. That's a myth. Depression doesn't cause suicide. Right now, there are well over 20 million people diagnosed with depression. We know that by tracking prescriptions, office visits, ER visits. Over 20 million. If you add to that the number of people who are uninsured, untreated for whatever reason, that number could jump upwards of 25 million. The suicide rate in the United States tends to run between 47 and 49,000, although this past year we went above 50,000. Common sense tells you if depression causes suicide and there's 25 million depressed people, why is the suicide rate 49,000? It contributes. It definitely plays a role, but it's not causal. So, you know, all these things play a role.
Doc, in the ranking of suicides, where do police officers fall in? You know, because we've heard like other professions are higher, but I'd just like to know if you statistically know where you know, police officers land in that rank.
If you look at the 10 professions that have the highest rate of suicide, police are third. Law enforcement comes in third. Now you're going to ask me who's first, right?
Yes, of course.
It used to be dentists. They were very high up, no longer. And it used to be veterinarians, believe it or not.
Really?
Right. As of now, it's blue-collar construction workers, especially those involved in extrication work. Those they have the highest rate of suicide.
Wow, that's interesting.
Yeah. I just want to, there you go.
Yeah.
All right. Well, I just want to go back 1 second. You know, a lot of stuff we're talking about here is looking out for one another, right? So there is, I found an interview that Inspector Mark Wakschal had done with Blue Line magazine. And there was a short video clip. The interview was much too long, but there was some clips. One I found that I liked. It was it's from the email. Looking out for one another. It's a short video. It's Inspector Mark Wakschal, who's the commanding officer, like I said, of Health and Wellness. I know you work hand in hand with Mark very closely. And I worked with him for many years. And like I said, he was my XO in the 110. And we both went over to the Personnel Bureau with Chief Pizzuti. And I think he was an excellent choice for the position. And this is one of the things that he said.
Look out for your officers. What do you mean by that?
We got to watch out. You know, and it's a lot. It's their mental well-being, their emotional, their spiritual well-being, and, you know, and even really after they retire from the job. And, you know, again, this job is extremely stressful. You know, what our officers see every day, the traumatic incidents that they respond to, sometimes there's really not a lot of time to process it. And then they go home and, you know, how do you explain an incident that was, you know, horrific? Now you got to go home and explain that to your loved ones, your children. So what we try to do here is, you know, we bring in the officers, and it's about reducing the stigma. It's okay not to be okay. And that's what we do here. And it's about bringing officers in and affording them the opportunities of all the programs that we offer in the health and wellness section, because we're all human, and we have to remember that.
Yeah, and that sends things tremendously.
Yeah. Inspector Wakschal is you know, really promotes finest care, as does Dr. Reddy, who I know you know as well. You know, they're our biggest supporters.
Yeah, Dr. Reddy is in charge of the psychological services section. He's a psychiatrist. I worked very closely with him when I was over in candidate assessment, because he was in charge of our psychological assessment section. So I did get to work closely with him. A gentleman, cares, and also specializing in alcoholism. So that a lot of the questions that used to come up in the candidates' background checks regarding alcohol, he was able to, explain. You know, because what do they say? The two most prevalent times that alcohol is abused is when kids are in college and when people are in the military. And what we used to always say during the interview process was, you know, it's time and distance from derogatory information, right? So if people drank a lot and admitted to drinking a lot in the Army or the armed services or in college, and now it's 5 years later and they have no summonses, they have no alcohol-related incidents, no DUIs. Well, why are we going to hold it against them when, you know, those are the times in your life when, you know, I'm not saying it's okay, but it's accepted or expected rather that alcohol is going to be used more. But to get off of that, if anybody has any, like I said, any questions for the doctor. Yeah, go ahead.
There was a question about a weekend retreat. Somebody had brought
TC,
up.
I think, had that.
TC or what's her name?
Oh, what's her name? Yeah.
You know, it falls under the umbrella of self-care, which is so critical to law enforcement officers. But whether it's genetic or it's learned on the job, I'm not sure. But cops have a real hard time putting themselves first. You know, they tend to put everyone else first and themselves last, which is a problem. But you know, it could be a formal retreat. It could just be getting away for an overnight somewhere. You know, go to a hotel in Jersey or Connecticut. But that self-care is incredibly important.
Yeah, TC does say something. He says the problem is everyone anticipates the return to the command after you go for help. Nobody wants to feel that way. Again, confidentiality is key. Everybody in the command doesn't need to know that you went for help and that you're receiving help. Like that one officer in the video for Finest Care, right? His partner didn't know that he was involved with Finest Care, that he was talking to them about whatever problems or issues he was having in his life. You know, he chose to share that to try and get help for this other officer. So, you know, the days of people getting psyched and everybody knowing about it, those really, unless it's some type of, you know, high profile incident that precipitates it, the command really doesn't know about it. It really, and not even the bosses. As a commanding officer, 2 precincts and many units and a borough, I wasn't aware when any members were under the care of any kind of mental health assistance. You know, if somebody came to me saying that they think somebody is having a problem, then I would get involved, but it isn't. And then let's Reed makes a comment also that the one above that, the department will remain stressful as the current administration is giving MOS allegedly Tuesdays and Wednesdays off. At least give them a chart so they can be with their families on weekends when the times come up. So I think this is when we are going to get to the point where we're going to ask you, from your experience of speaking with MOS at all these different seminars and through Finest Care and everything else, what is the biggest stressor? I don't want to say complaint because I don't want to call people complainers when things are affecting someone and it's causing them stress, because it's real. It's not, they're not just bitching and moaning. Some people bitch and moan about things, but if it's affecting your mental health, it needs to be addressed and not just, discarded as bitching and moaning.
You've just watched a clip from our live episode. Click the description to watch the full episode. Like, share, and subscribe for more videos just like this.